with the Lewis and Clark Public Health, and we're part of the Plan4Health grant that funds our Healthy Communities Coalition to create greater access to healthy nutrition and opportunities for physical activity for people of all ages, ability, and income. So in essence, we're really wanting to create greater equity in our community around access to food and physical activity. This is a view from one of our public parks in Helena, and we're looking at Mount Helena. And one of the things that we've done recently is, as part of our project, is have an increased commitment to having inclusivity, so that people with disabilities not only help to plan an active living wayfinding system, but they are also going to be users of the system. They'll be able to use it. It'll be accessible for them. So this is made possible in addition to by another grant by the National Association of Chronic Disease Directors that came to us about the same time as the Plan4Health grant. So it's been a real bonus for our community. And one of our most recent activities related to the project was to do some specific training for Healthy Communities Coalition members to actually create reflective practitioners who are attuned to inclusivity in not only their work but also in their day-to-day lives. So Mark Fenton, the nationally known and respected walk audit teacher, came to our community and actually worked with us to create a training that was with emphasis on inclusivity. So there were two parts of the training. The first part was the inclusive walk audit facilitator team training, and these were people who committed to coming to the training for 2 days, and that they were being trained to actually lead others, in fact, on walk audits around the community. So it was, we had 22 people who were trained as facilitators. They were multidisciplinary group, including engineers, public works, public health, community development, nonprofits, and many others. And then these groups, these teams, the following day did an inclusive, healthy community design workshop with Mark Fenton doing the groundwork presentation. And then we had a presentation by our technical assistance providers from the University of Montana Disabilities in Health program, and also from Montana State University with the nutrition and physical activity. Our fourth person was Amy Raworth, who's with NICPAD, who really is a really strong proponent of physical activity and access for people with disabilities. So there were a couple of our partners and our core team members for Plan4Health participated in the training and the workshop, and they have their own impressions that they're going to offer to us now.
Yeah, hi, I'm Laura Erickson with Lewis and Clark County Community Development. Some of the things that I saw that struck me were one of the facts that Mark Fenton presented was that people with disabilities tend to have a higher risk of getting chronic diseases because of their lack of ability to participate in physical activity. So including those people in the walk audits was kind of critical to having us learn how to allow people with different disabilities greater access around our community, and specifically a person who was vision impaired pointed out some aspects that I never would have thought of, and one was this outdoor seating thing that we're all proponents of outdoor seating, and he said it's very difficult to pass by these outdoor cafes using his cane if there's no actual solid barrier between the chair and the sidewalk. So there's just little things that we've learned that are really important to people that have impairments.
Hi, this is Allison, now president of the Western Central chapter of APA, and I also participated in the workshop last week as a participant instead of a team lead. And having been part of multiple workshops led by Mark Fenton in the past few years, one of the things I found most successful about this recent workshop in Helena was the fact that we were actively training individuals in the community as well as other cities, towns, and counties in Montana to be able to perform walk audits for themselves and their constituents. And so it was really interesting to be able to participate in a walk audit led by local community members who, as Laura said, had varied perspectives on what certain design features and functionality meant for them. While Mark Fenton is an expert in his field, I felt it was an entirely new experience to be a participant and learn from those on the ground in the trenches, so to speak, about their day-to-day interactions with how we design and build our walkable and bikeable and drivable infrastructure.
Great. Thank you, Laura and Allison.
You're welcome.
Thank you.